Okay, so aside from knowing your chemicals, you have to also know the equipments and the experiment setups that you are going to work with. And again, this goes to this will include aspects of knowing what are the hazards of the equipments and your experiment setups, what is the needed training before the use, to have that proper training before the use, the availability of work instructions and SOPs. There should be work instructions and SOPs that are available to the users for them to refer to, and also to have to prepare and to read and understand risk assessment. So you have to know the hazards of like the equipments that you are working with. You have to evaluate as well as understand what are the risks of these equipments and how can you control these risks. And we will discuss that in a bit, in more details in a bit. So in case of emergency, it's so important to take note of you need to have your spill kits. So depending on what was spilled, there will be there will be different spill kits for that. You have different spill kits for organic solvents versus those that are mainly for acids and bases. For acids and bases, you need to like neutralize first before you dispose of these spills. And so they will have different requirements. You also have different requirements if you're dealing with chemical versus biological spills. So biological spills, aside from like your absorbent pads and all, you have to have the disinfectant. So usually you have to mix a certain amount of like chlorine. You have to prepare at, I think, about 10,000 ppm bleach for disinfection. And also in some cases you can make use of like some tablet. So meron na kasing in tablet form na ilalagay mo lang sa one bucket of water, and then that will be used for the disinfection of your spill. So there are available kits for that. And you have to regularly check the contents of your spill kit. So in cases wherein nagamit yung mga spill kits, of course, some of these things will run out, like yung mga pillows, yung mga absorbent pads, yung gloves, etc. So some of these might have to be disposed because they are contaminated. And so you need to regularly check your spill kits to make sure that you have enough of the supplies that are needed in case of emergency. In terms of in case of accident also, you need to have your emergency shower and eye wash. So this is an example of your emergency shower, and this is your eye wash. So ito is more of a joint setup wherein meron kang eye wash station at saka yung emergency shower mo. So they have to be unobstructed. So ang hirap naman na kumbaga na aksidente ka na nga sa lab, and then madadapa ka pa or matatalisod ka pa on your way to the emergency shower or eye wash. So parang double jeopardy na siya, di ba? So you have to have unobstructed access to this emergency shower and eye wash, so that in case of any emergency, yun, mawawash ka agad either yung buong katawan mo or your eyes kapag nagkaroon ng aksidente. And also, you have to regularly check them as well. So, yun, mahirap din na magkaroon ng aksidente, yung pala hindi na gumagana yung emergency shower or yung yung eye wash nyo. So that can also be a problem. So you have to make sure that they are working well. And of course, kasi yung eye wash is going straight to your eyes and pressured yung water dyan, syempre. And so you have to make sure na laging malinis yung yung outlet nung eye wash station mo. So walang mga ali-alikabok or walang mga foreign matter that is stuck on the outlet of your eye wash. So importante 'yon. Otherwise, bubulagin mo pa yung gagamit ng eye wash if they make use of it. And yun, this is one way of like doing your regular checks. You have to make sure that there is water coming out, of course. So this is like one way. You have like some containment to contain the water. So you really have to let it flow, let it work, and make sure that it has the water supply. Also, spill kits. This is also very important. It has to be easily accessible and unobstructed. You have to regularly check them, so at least monthly, and make sure that expired items are replaced and items that has been used can be replenished. Kasi yun, you don't know at any given point if there is an accident which one of these first aid kit items you will be using, and so you have to make sure that you have enough of the supplies. In terms of like certain experiments or certain chemicals, there are certain hazards na merong special requirements. So for example, if you're working with hydrofluoric acid, you have to have a stock of the calcium gluconate cream. So that one is meant to complex the HF. Kasi yung HF can easily get absorbed in your skin once it reaches your I think it can actually corrode your bone. So and it can really spread in the body, and so it's really important that you are able to complex it or contain it immediately, and so they make use of this calcium gluconate cream to do that. And so if you're working with HF, of course you have to have the proper training when working with HF, and also to have this particular cream in your first aid kit. Okay, so far, kamusta? Any questions so far? Wala pa naman. O sige, tuloy ko lang. Okay, so what I'm giving now is more of, as you can see, it's more of a general laboratory safety. It's more of like what are the usual things that you have to take note of when working in the laboratory. Every now and then I will jump into chemical safety or biological safety. So these are the things that I mainly worked with when I was in Singapore, and most likely in my work currently. And so yun, it's more of like general reminders, practical things that you have to take note of when working in the lab. Okay, so